My name is Michael Goldberg, and I'm the executive director of our Veale Institute for Entrepreneurship at Case Western Reserve University. And I also am an associate professor at Weatherhead teaching courses on entrepreneurship. And it's great to have Will Lewis back on campus, proverbially on campus. I put Municipal Stadium as my backdrop to, bring back warm and fuzzies about going to Tribe and Browns games when you were a kid, Will. So
I appreciate that.
So that's the service. And apologies, and for those who are sort of joining now, and maybe those who are on Facebook who weren't able to join, we switched Zoom up today. Now it was password protected, so obviously some of you are finding your way here. So apologies for a little bit of the added delay in getting you on, but it's great. These sessions are all as part of our alumni speaker series, our student moderator, and we've got an awesome moderator today. So Akash Shah, who is an undergraduate who's part of a program that he can briefly mention that allows him to roll into the medical school after here. We met Akash through our colleague Paul Taysar, who's also on the call today, who's a professor at our School of Medicine and a co-founder of Convello. So Akash, it's awesome to have you participating today, and I'm going to turn it over to you. For those who are joining, if this is your first time joining one of our sessions or you've been here before, these are really interactive, so we want to hear from you. So either raise your hand, put a question in the chat. If you're on Facebook, just let us know you have a question, and Akash will be running the show. So I'll turn it over to Akash, and Will, thank you again for making the time with us today.
It's my pleasure.
Good afternoon. My name is Akash Shah. I'm a rising junior majoring in economics with minors in chemistry and finance on the pre-med track as part of the pre-professional scholars program in medicine, which is a dual admittance program into this Case School of Medicine. I'd like to first thank Professor Goldberg for providing me with this opportunity to host the event, Mr. Lewis for taking time out of his day to talk about his career journey and entrepreneurship, as well as everyone who's joined the call. If you have any questions that you'd like to bring up, please feel free to put them in the chat or message me, and I'll work them in as soon as I can. So I'd like to get the ball rolling here. And to start, could you please walk us through your career journey and how that led you to become the CEO of Insmed, Will?
Sure, Akash. And thanks very much for having me today. I just want to echo what Michael said. To the extent that anyone has any question at any time, feel free to interrupt. One of the things you'll learn about me, hopefully by the end of today's session, is that there's nothing that's taboo. I'm happy to talk about any aspect of my life, or certainly the business world as I see it. And I think that can be interesting only because my journey to the position I'm in now as CEO and chairman of Insmed is a circuitous one. I started out, I always like to say I graduated from college in 4 years, but I actually went to 3 different colleges. I started out at McAllister College in Minnesota, and having graduated, grown up, born and raised in Cleveland, Ohio, went to Hawkins School, graduated in '86, and went to McAllister College primarily because my oldest brother was there. I didn't really have a particular direction at that moment in my life. And I did a combination of Army ROTC, and then took a month off to visit and live in the Soviet Union. So my first year was one that was very experimental, trying a lot of different directions and a lot of different things, trying to learn as much as I could. I was fascinated by international relations. And so I touched a lot of the institutions that are involved in that field, I guess is what I would say. I found by the end of my first year that McAllister was an interesting place, but I didn't see myself there for 4 years. So I went to the University of Edinburgh in Scotland for my sophomore year, came back, had a fantastic time, came back from there and went to Oberlin College in Ohio, where I graduated in 1990. Almost immediately upon my arrival at Oberlin, I called up a government institution with 3 letters that begins with a C, has an I in the middle, and ends with an A. I don't want to say what it is, but I called them and said, what sort of opportunities do you have? And they said, well, where are you calling from? And I said, Oberlin College. And they said, well, is this a practical joke? And they said, I said, no, I'm quite serious. I'm interested in learning more. And so they sent me some materials and I signed up. And so after I graduated from college, from Oberlin with a BA in really 20th century what I would call Cold War studies, I went to work for the government for a few years. And That was an interesting time. The Berlin Wall had come down. The Cold War was sort of ending. And I was finding myself redeployed to the Middle East, where I was involved in the first Gulf War. I came back from that with a lot of perspective, I think, and came back home to Cleveland because at the time my oldest brother had been the attraction for me to go to college in the first place, was sick. And this really begins my journey into biotech. My oldest brother's life, without question, was extended for 20 years by virtue of the excellent work done at university hospitals on his behalf. And so I came back to be at home with my folks, and at that time, my brother, and I ended up spending that time going to graduate school. So that's where I came to Case. I did my JD MBA. I finished it in 3.5 years without taking any summer classes. And I was a pretty intense guy, very different from the guy that had started in college. I had a much clearer sense of purpose. And I have to say that Case was one of the places that really challenged me. My Weatherhead professors, I didn't get to go to this building, by the way. I had to go to the old one. So no luck. And by the way, no relation to the other Lewis, Peter Lewis. I wish there was. My career path might have been very different. But in any case, I ended up having a lot of professors who really challenged me. And one of them was a guy by the name of Sam Thomas, and he taught me finance. I hated math, I hated finance, I hated the idea of them, and I had a big chip on my shoulder about Wall Street. But he turned me around and he got me to feel like if it was anything like I thought it was, then it should be easy for me to go get a job there. And I should go and challenge that system. And the fact of the matter was, it wasn't easy. It was incredibly difficult. And it became a mission that I had. And I went from thinking I was going to grow up to be an attorney in Cleveland, Ohio, to becoming an investment banker at JP Morgan on Wall Street. And I had a fabulous experience there. For 10 years, I worked in investment banking. I lived in New York, London. I spent a lot of time across Europe, some time in Hong Kong, and just learned a ton about finance. And I came to be interested in high growth areas. So I did some technology, but I also did quite a bit of life sciences. And it was really this kernel of the experience that my oldest brother had and successfully being treated for cancer that drew me into that field and made me understand the power of what can happen when great scientific acumen, large quantities of capital, and really great human resource talent can get linked together in a nexus to try and change the outcomes of patients' lives who are born or inherit a raw deal. And that's a very powerful thing to see unfold, and I wanted to be a part of it. So after investment banking, I had been raising a lot of capital for a lot of different kinds of companies. I got invited to start up a biotech company with 2 other people. We managed to in-license a compound from the University of Pennsylvania, and ultimately that compound we managed to get approved. We took the company public, and then that was a springboard to my getting recruited to helm my current company, which is called Insmed. And when I joined Insmed, it was had $75 million of cash. It had a $75 million valuation. So for those of you who don't spend a lot of time in finance, that means that Wall Street thought it was worth 0. And yet it had drugs in development. And I believe that those drugs could see their way to approval. And so I joined, and I made the bold assertion to the group of 30 people in the room at the time that we were going to get the drug approved. We were going to take it around the world and launch it ourselves in the US, Europe, and Japan. And I'm happy to say 7.5 years later, that's exactly what we've done. So we've managed to get this drug, our first drug approved, build up a second drug, which is incredibly promising, and have a pipeline behind that. To date, that's meant we've had to raise a little over $1.6 billion of financing. And the company has enjoyed a really good run. We're now 500 people with offices around the world. And I had the pleasure of addressing the company this morning about the progress we've been making, even remotely. And I just have to say, there is no, in all the things I've done, whether it's the government work or, thinking about a legal career or investment banking, there's nothing more gratifying than being a part of a team of incredibly motivated and competent people who have as their North Star the idea that they're going to change the lives of the sick, and to keep that close to them every day as a motivating force. And yes, there's a cascade of other positive things that happen: good employment, a good work environment, wealth creation, things that are important to people as they think about where they want to go. But to be able to do all that and have it centered around societal good makes this a very special industry. So I'll stop there. It's a long-winded answer, but I wanted you to get some sense of how unlikely it is that I would end up where I am. I'm not a scientist, and yet I find myself in the middle of some cutting-edge biotech, which is really a fun place to be.
Thank you so much for that. It really helps, to gain a perspective on how everything's been going for your career. And because, like you said, your career was so long-winded and there was not a direct path to pharmaceuticals, how would you reflect on your somewhat nonlinear education and career path and how that's helped you achieve your career goals? Would you say any experiences were more beneficial? And do you think you could have skipped any of them?
That I've skipped any of them. Boy, I wish I could have. I could have gotten probably to a much bigger company a lot sooner. But for me, it was the journey. It was never the destination. And, one of the things I'm a huge fan of is reading biographies of other folks who've been successful and found a path to their passion. And if there's one thing I would put in the mind of everybody who is at the earlier part of their career or even in the later part of their career, it's take advantage of the lessons that others who have traveled this path have to teach us. And the first lesson that you get is follow your passion. Don't set out to make money. Don't set out to have a particular position. Follow the things that you're passionate about, and the rest will take care of itself to a degree. Because what you really want to be able to do in the end is I think, work and live for something that's bigger than yourself. And if you can find a way to bring realization to that, it's not uncommon to find many other people who wish to do the same. And in so doing, you create a really interesting, intentional community of people who are trying to have a work environment where they want to spend time, devote themselves to a particular passion or direction. And so the more diverse that is, the more helpful. And so I wouldn't take anything out of my career. Was it all necessary to get where I am? Certainly not. But do I feel better equipped now? Absolutely. The other day, someone came in and said, oh, this has happened. What are we going to do? We're in real trouble. And my mind immediately clicked into my first career. And I said, we're not taking enemy fire. No one's hemorrhaging. It's going to be fine. And so it's maybe a perspective thing in that sense, the first experience. But then also the notion that working in banking, you really can solve a lot of problems if you have excess capital. And anyone who's been around research knows that it's not linear. You can't say to somebody, okay, I need this drug to be developed and approved in this period of time. You can say that all you want, but if you want truly disruptive science, it just doesn't follow that path. And so what you have to do is make sure that you provide the resources and the environment for people to find the best way forward. And it is circuitous sometimes, and that's okay. I think when I was growing up, I certainly felt like there were certain steps I had to go through, and I rebelled against that. I hated the idea of following the prescripted path. And I had a major chip on my shoulder about doing things differently just for the sake of doing them differently. And I think sometimes that was inefficient, but it also kept my mind in a place where it could continually question whether or not the traditional path followed by everybody is in fact the right one. And I don't mean just from an ethical point of view. I mean from, is this really the best way to develop this drug? Is this the most efficient path? Can we do it faster? Can we do it less expensively? Well, no, it's always done this way. If there's one thing people who work with me will tell you, it's that if you come to me with an answer that says, but it's always been done this way, that's the start of a very difficult conversation, because I will say, all right, start all over and tell me that may be the path we choose to follow, but tell me that you've gone through the analysis and the thought process to ensure that it's the necessary path to follow.
Thank you for that. I mean, it clears it up, like no experiences should be shortchanged and everything will play a role into the future. So I wanted to make a quick transition here into talking about the current COVID-19 pandemic and how that's affecting your pipeline. So could you talk a little bit about how that's made you restructure your pipeline or focus on something else?
Yeah, so like everybody, we're trying to respond to this global pandemic. And someone said to me the other day, the facts that we're facing right now, if you wanted to know what it was like to be a part of the pandemic, the flu pandemic at the turn of the century, some sense of what the Great Depression was like, and some sense of what it was like to be in the so-called race rats of the 1960s, we have all three going on right now. So we have a full deck in front of us as individuals and as companies and as institutions. And I think how we choose to respond to that is really important. And I talked a moment ago about intentional community and what that means. And what that manifests itself as is the ability to pivot and engage in ways on any one of these topics that can be hopefully contributory to their improvement. So in our case, we have drugs that are focused on primarily the pulmonary system, lung ailments. Our first drug treats a bacterial infection. COVID-19 is a viral infection. And so we thought immediately, could our drug be useful in that context? And the answer to that is no, because the viral infection does not, although it can happen, it does not give way to greater susceptibility to bacterial infection. But we looked at the rest of our drugs, and the most promising one that is coming along now is what's called a DPP-1 inhibitor. And it is a drug that inactivates certain components of something called the neutrophil. And the neutrophil is recruited during disease process at times, almost as a cascade that can overwhelm and contribute to disease and damage to the body. So our DPP-1 inhibitor may have a role to play, and we desperately wanted to be in the COVID-19 fight. We wanted to find out if there was a way we could use our drugs or our technology to help, and so indeed we did take our drug, and it is right now working in 10 different sites across the United Kingdom under the direction of Professor James Chalmers at the University of Dundee in a 300-patient placebo-controlled study looking at whether our drug can improve patients as they get admitted to the hospital. Oftentimes they go into respiratory distress, what's called ARDS, or acute respiratory distress syndrome. And so our drug is hopefully going to derail that progression. And we'll know the answer to that by the end of the year. But that was our first thing to do, to engage, to respond, to try to contribute a drug that could help the situation. Practically, we've had to shift to a virtual world, obviously, like everybody else. We have about 100 commercial folks in the US and across the country. We had to pull them out of the field and have them work remotely. We had to move some of these interactions with patients and physicians to a telemedicine kind of setting. So what we have here is, your usual adoption curve of technology has been redshifted on top of people, and those who are resistant to it are now being forced to adopt it. Well, that's a great opportunity in industry to try to utilize that pressure to bring about a more efficient way of bringing health and medicine to people. So we've been focused on that as well.
So do you believe, with the changes that you've had to make because of like the COVID-19 to your company, that you're going to keep moving forward in these new workplace environments, or are you planning to shift back to how you had previously conducted research with your pipeline?
Yeah, research is the hardest part, right? Because some of our labs had to be shut down or at least adjusted. What we now have, and one thing you'll learn about research folks in the biotech community, they're not looking for an excuse to stay home. They really want to be in the lab. They really want to do work, and they're passionate about it. And so we have to find a way to enable them to do that in a way that's safe. So we've had rotations of shifts. People come in, there's 6-foot distancing. We have constant cleaning of the place. And that seems to have worked well. It's enabled us to move forward critical experiments and study at a time when otherwise people would need to remain isolated. Going forward, we're going to have a mix. I mean, the teleconferencing thing has worked very effectively. Our company, I would say, is strangely more productive now than it was prior to this. And I don't know if you've had this experience. Apart from Zoom fatigue, the reality is that I find myself drifting into longer hours even than I had before with people. I look down, I realize I've forgotten to eat lunch, that sort of thing. So I think, taking an hour, for me, it's about an hour and 20 minutes of commuting time out of my day, and deploying that in some other fashion has been fantastic. I have people who've commuted, because we're in the tri-state area around New York City. Some people commute from New York City. That's an hour and 15 minutes each way. And bad traffic, you can add another 45. So to take that time back and put it into the hands of people and take away the stress, that's a pretty powerful thing. And I think now that people realize they can be productive by remote, we're going to continue that for sure.
Okay. So transitioning to some questions from the attendees and panelists. Andreas has a question. Would you like to ask that?
Sure. Thank you for your time. I had a question regarding how does your company respond to the tight marketplace now and biomed companies in the era of COVID? How do you pivot? You mentioned pivoting as a main component of your not only career, but your company.
When you say pivot, you mean with regard to our strategic initiatives on drug development or in other ways?
Yes.
Drug development. So, our core efforts are in the pulmonary space. And so we're sort of already at ground zero for COVID-19. That makes it challenging because we call on pulmonologists and infectious disease specialists. And for about a month or two, they were out. They said, not only stop calling on us, but we're busy preparing the hospital for the expected influx of COVID-19 patients. And so we were one of the first companies to pull our entire commercial infrastructure and send them home. And we said, we're going to do this even though it's going to hurt our sales and all the rest of that, because we have to start with what's in the best interest of patients. And unintentionally, as carriers of information, we can end up becoming carriers of the virus. And if you think about the most vulnerable people, it's those who are older, those who have pulmonary conditions that are pre-existing. That's a really bad recipe. So we were very concerned about the patient population that we are trying to treat with our approved drug, and we decided to pull the commercial infrastructure back. So from that, we then reached out to the pulmonologists and the hospitals and said, how can we be helpful? And if you tell us to go away for 2 months, then we will. But what we found, interestingly, is because we're in such a specialized area, a rare disease where there isn't a lot of knowledge in the medical community, our services are very valuable to them. And we provide a great deal of support to patients who are on our drug with follow-up, what we have called an AeroCares team, which surrounds the patient with support as they're trying to figure out how to use the drug, what the side effects are, how to deal with that. My belief is the goal of the company is not to produce a drug that's approved and sell it. The goal is to help the patient outcome. And that includes not just delivering the drug, but surrounding the patient with the kind of support that someone who is older and maybe more isolated may need, which is just spending time on the phone with them. So we have a lot of stuff that extends around this world. And in many ways, as I've said to employees, we're in a place right now where we're experiencing firsthand what it would mean to be one of these patients. The bacterial infections that they get that are very difficult to eradicate cause them to have to live their life in fear constantly of getting reinfected from that bacteria. We're having that experience right now with COVID-19, and we get a sense of how much that affects our life. So I think we're uniquely positioned around this moment to try to extend our empathy for those patients based on our own experience with COVID-19, to redouble our efforts to develop drugs that can be helpful not only for COVID-19, but for comparable pulmonary diseases. And we have a very good pipeline of programs that will allow for that. On the practical management of the company side, my view is the CEO's number one job is to ensure the cultural development of the company. If you hire great people, you don't need top-down management telling people what to do. My mantra at the company is, how can I help? And I expect people to follow the same rule, which is if we have capital and we have great talent, we all know what the problem is and we all know what our talents are and our objectives are. We're all adults. One of the first things I did when I took over the company was to get rid of vacation days, the concept of a limited amount of vacation. It's just crazy. We're all adults. If you need to take vacation, take vacation. And I say to people all the time, that allows people who come from different backgrounds to go spend a month in India if they want to. Good for them. That's great. That allows them to fulfill personally and professionally. And I think as we think about COVID-19 and its impact on society, more of that sense of personal responsibility needs to be built upon, in my opinion. And so I'm trying to make this intentioned community be about Yes, helping the patient, but not necessarily doing it by following my particular instruction on what you need to do. Rather, Andres, you have a talent, you're being hired by the company. Now, how can I help you be successful? It's a strange conversation to have with people who are accustomed to being told what to do. And I often say to people, Insmed is not a better company. It's a different company. And it may or may not be for you. Some people want that direction. Many want independence and self-responsibility. And those are the people we're looking for. And into the environment of COVID-19, what I've found is the 500 people at Insmed, they flourish in that environment because they're expected on their own to go figure out what to do. Well, that's what they've been doing all along. So we're very, very lucky in the composition of the company and the talent that we have.
Thank you.
Gosh, you're muted.
Now we have a question in the chat from Donna. Would you like to introduce yourself and ask your question?
Oh, hello. Hi, everyone. I'm Donna Luisa. I'm from Trinidad and Tobago. And this is quite an interesting conversation that you're having here. So my question is relating to sample testing via a tele-remote monitoring system. Would that work in a situation like now where folks need testing without going into the hospital, going to see the doctor? And I'm asking this because I am in a high-risk group and I have been monitoring myself since early March. And I do believe that while I may not have contracted COVID-19, I do think that going out is a little bit scary. There is not a vaccine. There is not a specific solution right now. And I'm pretty sure that by staying in, it may help, but it also may not help with your immunity, because you need to be out there to build your immunity. And at the same time, you're dealing with a situation where going out is not healthy. So I like the idea, and I like the way things have turned around, where the tele-remote medical advice is available. So what are your thoughts on this, and your company developing something along that line where it relates to monitoring people who have been tested and who are on a sample drug or vaccine?
Yeah, it's a great question. And I have to tell you that you're touching on what is likely to be a major shift in the administration of medicine and health generally. Telemedicine has been around for a while, but people haven't really embraced it. One of the silver linings in this particular cloud is that in many cases, people haven't had a choice. And so physicians, instead of saying, I would rather see you in person, because they're accustomed to evaluating a patient in person. They are more successful that way. And their mission and their drive is to be helpful to their patients. So telemedicine is now forced upon the moment, and people are very much prioritizing workarounds for some of the challenges that you're talking about. Instead of saying, can I administer and diagnose this patient through telemedicine, it becomes, how can I do that? I must do that because I have no other choice, and the patient's health requires it. So many of the tests and sampling techniques that are used, typically through regulation, are not permitted to be done in this sort of fashion. A lot of those regulations are being loosened at the moment. So for us, for example, one of the things we look for is the presence of bacteria that causes lung damage in our patient population. They provide a sputum sample. They typically do that in the presence of their physician. We're now in a place where we can collect those remotely. The physician can do so and have it sent to the lab, and then the lab does the work, the physician gets the message, and then they can have a dialogue about what the finding is. There's some evaluations that the physician would prefer, and in some cases needs to do in person, but a lot can be done remotely. And what I would give you is encouragement that those trends are accelerating right now. We don't have all the answers, and certainly we need to get the regulatory approval. The first and most important thing is quality control to make sure that we don't miss something. But a lot of this is being thought about in creative ways to make sure that we can get to people who by definition have to remain remote. So our company is not involved in the diagnostic side, but we do use other diagnostic tests that other companies make, and we have found a way to bridge the use of some of that to the current circumstance. And I'll go one further. Last week, I spent a couple of hours on the phone with somebody who is demoing the HoloLens, which is this virtual augmented reality set of goggles that Microsoft has developed. This is really cutting edge technology. It's been around a while, mostly used for video games. but what we're starting to do is use it to go and maybe there's a way for a person to have an interaction using such device that gives a more virtual feel, an augmented feel to that person-to-person interaction. So anything we can do to improve that experience for the patient is something we're prepared to invest in.
Thank you very much.
You're welcome.
So the next question in the chat is from Paul. Would you like to present your question?
Thanks, Gosh. Thanks, Will, for taking the time. Really exciting to hear your story. Question, sort of thinking about to stimulate discussion here was, as you engage more with your alma mater and with your hometown, what do you see as the major opportunities for the region in biotech, given your success now running Insmed, and how do we be successful, and moreover, how do we be different than the coast so that we can really compete and drive success in our own way, in our own little niche?
Well, that is the question that a lot of communities ask themselves. You start with ideas because however much people want to spend time talking about the so-called CEO of any given biotech company, the real magic is the science. And so you have to have first-class science. And one of the great things about where CASE is that it sits between the Cleveland Clinic and university hospitals, as you all well know, surrounded by some great professors and thought leadership, and the opportunity to take that and suggest, where could we go with this? How can we theoretically make a dramatic impact on a healthcare scenario using a diagnostic or a device or a small molecule or some other kind of cutting edge technology like gene editing or gene therapy or mRNA delivery. All of these different cutting edge medicines and science start in academic centers. And once that gets to a point of interest and maturity, then you need some capital and some people who are willing to go and take that and run with it. And finding great talent or even experienced talent to help facilitate that is challenging in the best of locations. So in New Jersey, there's an awful lot of large pharmaceutical companies. And so there are lots of people that have experience in pharmaceutical development. Most of them fail in biotech because working inside a gigantic organization is very different than being one of 10 people who are doing any task they have to advance to the next stage of proof. The way you build a great biotech ecosystem is to have one successful company, one wildly successful company, which mints a bunch of people who have that credential and that experience, and then they go out and they build their own additional companies. And that's what really creates the flywheel of innovation and appetite to have that innovation, and people see that success and they're drawn to it. You can look at what happened around Amazon in the Northwest, and that entire state and community are changed by virtue of that one success. The same was true for Microsoft. We don't even need to talk about Silicon Valley because we know what happened there. I am not convinced that Boston ended up with its concentrated biotech hub because of the presence of Harvard or MIT. Most of the technologies that were there were spawned following a particular type of biotech company doing well. So Genzyme was one of the first pioneers of rare disease medicine, wildly successful, and tons of people left that company to go off and start other companies in Boston. And that talent was recruited and re-recruited, and it builds a flywheel of success. There is absolutely no reason why Cleveland could not be just as big in, if not bigger, in the life sciences than any of those other regions. It just needs a win. And it needs that win to be very big. And then people will say, that's the place I need to go and be a part of. And I would be more than happy to be engaged in any way around making that happen, because I still have that chip on my shoulder about not only the city of Cleveland, but also the idea that there must be a certain path or a certain place where this kind of thing happens. That's nonsense. We can see repeatedly throughout history examples where those molds are broken. And in fact, some of the most disruptive and innovative science and some of the most interesting and transformational ideas come from the unexpected place. It was not a week ago that Elon Musk put 2 astronauts in the International Space Station. This is a guy who made his money off of eBay and then took $100 million of that money and decided to go build a rocket company. He has 0 experience in rocketry. He flew to the former Soviet Union and tried to buy their rocket technology, and they laughed him out of the country. They couldn't believe this was one of these wealthy, moronic Americans who comes from South Africa, immigrant, has no idea what he's doing. Maybe they got it wrong, right? He rewrote that industry. He took on Detroit and rewrote the automobile industry. The audacity to believe you can create the greatest biotech company in the world in Cleveland is an absolute prerequisite to that being accomplished. The talent and the science and the capital are there.
Thank you so much for that. I think the next question is from Corey. Would you like to introduce yourself and present your question?
Yeah, he just messaged me. Guys, just read his question. He said he was having some connectivity issues, so you might have to read the question for him.
Okay. Corey's question is, how, as the CEO of a biomed company, do you make sure that customers are served at a fair price? There's a lot of discord about the intentions of other biomed companies.
Yeah, that's a great question, and it goes to the heart of one of the things that we were really wrestling with as a society up until COVID-19, and then everybody kind of stepped away from it. But it's an extremely important question. Let me try to give you some statistics that I use to ground myself when I think about this. And you often hear the pharmaceutical industry say, if you go back to the 1960s, and this is actually something that Warren Buffett is fond of saying, the percentage of our gross domestic product that was focused on corporate taxes in the 1960s was around 4%. If you move forward to the most recent time when the legislation was passed, the gross domestic product represented by corporate taxes was 2%. And the initiative that came out of Washington, D.C. was to cut corporate taxes. If you go back in time to the 1960s and look at the cost of healthcare as a percentage of GDP, it was around 4 or 5% at that time. Currently, it's about 18%. So there has been a massive tax, a massive cost component that has dwarfed all of our other gross domestic product investments in this country that is related to healthcare. Healthcare is a huge amount of our GDP, and it is growing rapidly. Now, there's a ton of innovation around that, and we've seen life expectancy get extended quite dramatically along with quality of life. So huge advances have been made. But why suddenly the debate about price? Well, here's the issue. This is a very heavily regulated industry. In order for me to bring one drug forward, and this is not hyperbole, I've had to raise $1.5 billion. I've had to go to investors and get them to invest $1.5 billion. This is the only industry in the world where I have to build redundant manufacturing capacity before I even know I have a product. right? So I have to be ready to sell the drug day one. That's regulated. It has to be monitored. It has to be approved by FDA. And I need that at scale so I can get it to all the sick people around the world. But I have to invest all that money in a world where there's a possibility the FDA may say, nope, your data is not good enough. The drug isn't approved. And then all of that investment goes right down the toilet. So it's a huge bet. It's a binary bet on every drug. And historically, when we did this, we were going after something like high cholesterol. Well, there are 50 million people in the United States that have high cholesterol. And if you are going to charge to make back the money you had to invest to develop that drug, and you're going to spread it across 50 million people, it's a couple of dollars a pill. It's not that much. The company can still make money. You could charge $1,000 a year and you'll be fine. You'll make a ton of money. The investors get a return. You can plow money back into research and development. That equation works. What's happened in the last 10 or 20 years is that we have now started to focus on specializing and refining our targeting of disease. So we're not going after populations that have 50 million people suffering from disease. My company targets a disease that had nothing approved to treat it prior to my arrival. These are patients who have failed every other therapy that is possibly out there, including those not approved to treat the patients. Physicians have tried everything. We developed a drug for this population, the so-called refractory patient population. There are 12 to 17,000 of them in the US. Take simple numbers. If there are 10,000 patients we're going to be able to reach with our drug, and we had to raise $1.5 billion to get that point, to break even on that investment, we have to charge every one of those patients $150,000. And that doesn't account for the risk-adjusted probability, which is much, much higher. So the reason drugs end up costing so much is because the process of their development is regulated. There are no shortcuts. You have to go through all these measures. You're addressing smaller and smaller populations, and you have to spread that cost out over all of that population. 50 million people, the drug price can be small. When it's 10,000 or 15,000, it's going to be a lot higher. And so that's a difficult discussion to have. I think what we need from a public policy point of view is to remove the burden on the individual patient. If I were to leave Insmed tomorrow, the first thing I would advocate for is the removal of substantial copays for anybody paying for medicine. Because if you wake up one day and find out you have cancer and your insurance doesn't cover it, or you don't have insurance, and someone says we have a cure, but it's $350,000, it's over. Nobody has that kind of money. And so that's a discussion where I think we need to spread that burden across the country. It's not nationalizing medicine. It's simply saying we're going to cover the cost of the copay. Right now, it is illegal for me as a company to provide the cost of the copay for our medicine to anybody on a government program. The reason the government does that is to slow down the uptake of that medicine. It sounds nefarious, and in my view, it is a bit, but it's trying to create friction around too much high-cost medicine getting used too broadly without regulation. And so by pinching the individual consumer, it slows it down. Now, there are mechanisms that have evolved to try to compensate people in that, but the reason our medicines cost a lot is because it's a regulated process and we don't have any choice. We have to run all those tests, animal tests, human tests. It takes 10 to 15 years to develop a medicine, and these costs are huge. If I could, I'd give the medicine away for free. I can't. And my investors demand that we get a return for them. We are losing at our company $350 million a year. Let me say that again because it sounded like a big number. We are spending $350 million a year, and we will not make money, profit, for at least another 5 years. So there are billions being spent with a successful approved drug to try to make this possible to reach other people in other parts of the world. And that's a very difficult equation, but that's why they cost what they cost. That's what the trend is. Interestingly, of that 18% of GDP, medicine, what you take, represents about 12% of the overall healthcare cost picture. 30 years ago, it was the same amount. The total cost of medicine has not gone up as a part of GDP. The difference is that back then, every drug was novel and was non-generic. Today, 8 out of 10 medicines are generic. So all of that cost is coming from a very small sliver of medicines. So that's when you read these stories about $1 million gene therapy and that sort of thing, very expensive stuff. If you're only going to give the gene therapy once to a patient and it's going to cure them for the rest of their life, it's hard to make money off of that. And if you can't make money, you can't attract capital. So it's a little bit of a vicious cycle. It's a lot of complexity in there, but I hope that gets at some of the reasons why our medicines cost what they do and how we work that balance.
Thank you so much for attacking that, that question about drug pricing. I think we'll only have time for maybe a couple more questions. The next question comes from Gemma. Would you like to introduce yourself and ask your question?
Hi, Will. I'm calling from Germany. I'm also, hello, do you hear me?
I do.
Okay, sorry. I'm also an alumna of Weatherhead. So I'm very impressed by your passion with which you run your business, and your contribution to beat or to fighting this crisis and pandemic is definitely appreciated and applauded. My question is on the psychological side. Did you have this during this pandemic? Did you have any emotional moments or disappointments or thoughts that things could have been done better? And how did you motivate yourself and the staff?
Yeah, no, I appreciate that question. I think I'm quite proud. I caught a lot of heat when we pulled our commercial workforce out of the field before this was really the thing to do. I pulled all of our financial guidance as a public company. That's always an interesting moment. Investors don't tend to like that. To put this in dramatic fashion, we were trading at about $33 a share. I think we got as low as $12 a share when I did what I did, but that was because it was the right thing to do. You have to go forward with your compass point clearly in mind. We've got to protect the patients. I have to protect my employees. If that disappoints Wall Street, between you and me, I don't really give a damn. What I care about is that we have a sustainable business that is built around an intentioned community that is trying to make a difference in the world for these patients. And so while the initial reaction was very negative, we're almost back where we were. So I counted on the fickleness of Wall Street to be upset and then to decide that, it was okay and all that. They can do that. In my mind, what could I have done better? I wish I'd seen COVID-19 a little earlier. That's one thing. I didn't. I saw it earlier in terms of our actions than many, but in the end, we're still in the same place. So I'm not sure that matters as much. Maybe some feeling of gratitude that we acted in a disciplined way despite the self-harm, and that is going to inure benefit for the medium and long term. I think there's no question from a public policy standpoint that this could have been handled better. And I'm a long-winded guy to begin with. If I start on this one, we'll be here for 3 hours. So all I'll say to you is my good friends over in Germany, our country manager, Olaf Bartsch, who I've been working with at this company and my prior one for many, many years. He happens to be one of the people that I trade these ideas with. And the text messages have been burning. How about that? The public policy response was inadequate. Why? In summary, because at a nation state level, there was a lack of coordination inside the US from the federal, state, and local level. And we've seen that come apart before our very eyes. Whether or not you're one party or another or pro this person or that person, let's set that aside and just look objectively at the ability of the leadership at all levels to come forward with a clear and concise message that says, here is the plan and the method for execution. That plan may be wrong, but at least it's a plan and it's coordinated. When you start and you say in the conversation, it's not my fault, Doug's next to me on this screen right now. He's the one. If he had just called me earlier, then, and I told Michael to be worried about this, but he wasn't, that doesn't help. What we need is clear understanding. And when you don't have understanding, it's imperative that you are transparent and honest about that. And that's where we fell apart. And then there's the practical logistical side of the country is extremely good at collecting taxes from each individual. But at the moment when you need to transmit capital back, there's no mechanism for it. So we have no way to provide a bridging pathway financially for individuals that's particularly efficient. So that adds further uncertainty. And then the inability of logistically distributing actual PPE, personal protective gear and clear messages on how to use that made things worse. So we spiral out of control here. We're still in that scenario. We add to that economic distress and the unfortunate events that have spilled over violently, and we got a real mess on our hands. And now more than ever, there's a need for leadership. And I feel like that leadership can come from any quarter. It can come from an individual, it can come from a nation state. But the time has come for everyone to get into this event and do what they can.
I think I have time for one more question before I have to hand it back to Professor Goldberg. So on a more overarching aspect, for recent graduates or students graduating soon, what is the one piece of advice that you could give them to be successful in the career of their choosing?
Follow your passion, no question about it. And if you don't have your passion yet, find your passion. Don't be afraid or ashamed if your passion seems incongruent with the success of a particular area that is interesting to you. You may not be a computer wizard, but remember that Steve Jobs was a college dropout who found calligraphy interesting. And that interest in calligraphy, that genuinely pursued interest in calligraphy, empowered the first Mac computer to have a variety of fonts with which he was familiar. As an artist, he coupled with a technology person, and together they changed the world. So don't be confused into thinking that you must be good at science, math, whatever it is. Do your best in those things, absorb as much information as you can, embrace the circuitous route that may take you in a direction that will drive you and probably your parents crazy. But the fact of the matter is, if you follow your passion, you will always be true to yourself. And when times are low, and they will be, I always say as an entrepreneur, the highs are higher and the lows are lower. But if you follow your passion, you'll pull yourself through that without effort. Whereas if you're following something that you think you're supposed to do, I should go be an investment banker, you'll be miserable. And in the end, you'll look around and say, what have I done and spent with my precious time? Because that's the most important resource you have is your time. And right now, it feels like it's in abundance. Believe me, you'll blink and it'll be gone. So follow your passion. And if you want, I would strongly encourage, reading some of these biographies. The biography of Elon Musk, if you're interested in entrepreneurship. The biography of Steve Jobs is an absolute essential read, in my opinion, because it will teach you and remind you that whatever your passion is, if you follow it, it can take you all the way.
Thank you so much for, everything you've answered and given us today. I'm going to have to hand this off to Professor Goldberg now.
Well, Akash, excellent job moderating. I think one of the real joys of this series is seeing amazing students like Akash flex their moderating muscles and engage with our speakers. So thank you for doing that. Well, thanks for the words today. It was a great session. I know you're going to be busy on Zoom this week. Unfortunately, as you engage as a Case Western Reserve University board member, I guess this is your maiden voyage on the board this week of meetings. So thanks for everything you're doing to support our school and our city. And we do, when all this clears, we look forward to welcoming you back on campus and back to Cleveland soon.
It'll be my great pleasure. And thank you all for today. It's a real joy to talk about this stuff. If I can be of help to anyone, please let me know.
Great. Just a couple of quick announcements while I have folks here. We have two sessions scheduled next week. On Monday, Connor Demon-Yeoman, who is a native Clevelander, a Princeton grad who worked at Coursera, which is one of the platforms that we partner with at Case to put our classes online, including my own online class. is going to join us. Connor's the co-CEO of a company or a nonprofit called Merit America. So he's focused on training tech skills for folks that are taking sort of non-college routes. So look forward to being in conversation with Connor on Monday. And on Tuesday, for those of you interested in our changing social media landscape, Adam Bain, who is the former CEO of Twitter and used to work at Cleveland.com, is from Northeast Ohio, is going to join us on Tuesday. So both of those sessions will be at 1 o'clock, and we'll be adding sessions along the way with a diversity of topics and speakers. So check back on our schedule. So again, Akash and Will, thanks for doing this, and look forward to seeing everybody soon.
Great pleasure. Thank you.
Take care, everybody.